Our group did look at specific country experiences. First, we heard a paper, an analytical study that looked across countries at what has really worked to reduce child malnutrition. It was an IFPRI paper. And what that showed was that economic growth, especially agricultural growth, does help to reduce child malnutrition. It also showed that focused efforts to raise incomes, improve education, improve health and the status of women among poor people, those things also work, in fact, more powerfully to reduce child malnutrition. And in most of the countries that have had durable and impressive results in reducing child malnutrition, there's been both economic growth, agricultural growth, and focused efforts to strengthen education, health, and nutrition among poor people. We heard country case studies from two really inspiring countries, Brazil and Ghana. And both countries did just about everything right. So both countries achieved good economic management, rapid economic growth, strong growth in agriculture. They also made really serious efforts to improve education, health, and nutrition among poor people. All those things came together to produce lots of good outcomes, including substantial reductions in malnutrition among their children. We also heard a country case study on this massive country of India, which has achieved spectacular economic growth and substantial progress against poverty and malnutrition, but much less progress against malnutrition than you might have hoped, given the economic successes all around in India. And so the analysis was that it may be partly because agricultural development has been less rapid than growth in other sectors, partly because of relatively weak health services, partly because of the relatively low status of women. Also, this is a very big country, so there's huge disparity in different parts of the country. So in one part of the country, you see big economic growth happening. In other parts of the country, not as much growth and much more malnutrition. I think there were quite a few Indians in the group, and there was some heated discussion about what the data really show. I think I drew from that we don't entirely know why India's economic successes have not achieved as much in terms of child malnutrition as might have been hoped. I was interested, one thing that was just really clear in all of the country situations that we discussed was the importance of good government, committed government. That was clear. So we talked a little bit about how do you get a good committed government? How do you make that happen? In Ghana, for example, it's not just one presidency. There's been progress against malnutrition through several administrations. So how do you get a good government? Anna Larty from Ghana said, our people have learned about democracy. So if we don't have a good government, we throw them out. I like that. I was interested that both in the case of Ghana and Brazil, one beneficial impact has come from the MDGs and international conferences. I was really surprised that a country as big as Brazil would really be influenced by MDGs, but there was some sense that the global conversation about reducing malnutrition, reducing poverty, has made a difference in many countries. And then finally, there was some discussion about the importance of champions and of advocacy within countries in achieving good, committed government.